The next witness, I believe, is Marianne Sorrentino. Welcome to the committee. Welcome to the committee.
Hello.
Yes, welcome to the committee. You have 3.5 minutes. And if you could state your name, please.
Thank you, Madam Chairman. This is Marianne Sorrentino.
Welcome.
I used to be the executive director of Planned Parenthood of Rhode Island, which was the first abortion facility in the state, as you may know. So I called you so long ago that I've left my house and I'm out to dinner, actually, but I came into a quiet place to talk to you because, you know, there are a lot of concerns expressed by assorted people, and I understand that this is a controversial issue, but I just wanted to underscore how important the availability of safe and legal abortions has been to women all over the world, and especially in places where women remember the days, as I do, when they were driving a friend to an illegal abortion, and then she was driving her home and she was hemorrhaging in the backseat of your car. So if we remember those things, we sometimes need to stop and think how necessary it is to have legal and safe facilities, because as I have told the legislature many times when I was a lobbyist and talking to them about this issue, you cannot force women to have children that they don't want to have. It's not going to happen, and a woman will always do whatever she has to if she's made that decision. So it's best if we allow them to have access to safe and legal procedures, and that's all I wanted to underscore. But I thank you for raising the topic, and I wish you well.
Thank you very much. Any questions for this witness? Thank you very much for joining us this evening, and thank you for your testimony.
Thank you very much.
You're welcome. The next witness, I believe, is Barbara. If you could pronounce your last name, and then you have 3.5 minutes for testimony.
Okay, my last name is Wierzbicki, first name Barbara, and I am commenting on the Access to Abortions Bill S-267. I am a pro-lifer. I think that in our society, much has changed over the years since Roe v. Wade. We now, as women, have the choice of using different contraceptive methods to prevent abortion, and I think that has to be weighed heavily on the whole abortion issue, because it means that we would never get to the point where abortion would be necessary, except, of course, in cases of rape or incest or something, really horrible like that. So I think that we, as a society, have to take a look at where we are today versus where we were so many years ago, and consider the options available to women to prevent abortion. This is in addition to controlling emotions, controlling your body, being in control of your life. But in addition to that, if you are weak, there are methods to prevent conceiving a child. And I think those should be weighed extremely heavily before we continue along this path of killing babies.
And you also have other 664, 645, and 669 you'd like to speak to, and it must be done within the 3.5 minutes.
Is this on the same topic?
Yes.
Excuse me.
664,
well,
yep.
Okay. Well, I would say that the comments that I have just made kind of represents my feelings relative to this issue, and I would hope that our legislators would take this really seriously. We are talking life and death here. It's not right. It's not right. So I hope that the correct choices will be made. Thank you very much.
Thank you. Thank you for your testimony. Any questions for this witness? Seeing none at this time, thank you for joining us this evening.
Thank you very much.
We're just waiting on the next caller. Welcome to the committee. I believe we have Colette Sosnoe on the line. Ma'am, you have 3.5 minutes for your testimony. You may begin.
Great, thank you, and I will probably take much less. So I live in Providence, just to put that on the record, and I'm urging the Judiciary Committee to vote yes on the Equality in Abortion Act this afternoon. And the basic reason is that abortion care is health care, and not providing insurance coverage for these services is discriminatory, in my opinion. Insurance doesn't discriminate for other reproductive health services like sexual health and pregnancy care. We don't tell women to pay for their own mammograms or pap smears, and abortion care is no different than this. So I think it's wrong to exclude the service, and I appreciate your yes vote. Thank you.
Thank you for your testimony this evening. Any questions? Seeing none at this time. Go ahead. I don't see any questions from the committee members. Did you have something else you wanted to say?
Nope, that's everything.
Okay, thank you. Thank you for your testimony. Next on the line, we have Catherine Hillary. Welcome to the committee. You have 3.5 minutes for your testimony, ma'am.
Oh, thank you. Again, my name's Catherine from Newport, speaking in favor of Senate Bill 267 as a member of the Rhode Island Democratic Women's Caucus and the Women's Project. To impose a financial barrier to abortion on people on Medicaid puts an undue burden on poor people, including many in our Black, Brown, and Latinx communities, as well as young people. No one makes the decision to have an abortion unless it is medically, financially, or socially, meaning due to incest or rape, necessary, and all women should have the right to these decisions without barriers put before them by the state. Rhode Island has already codified Roe v. Wade into law, and to start making exceptions for people who cannot afford abortions has racial consequences, since it is well known that Black and brown people have less money than whites on average. Rhode Island has the opportunity to recognize this as evidence of systemic racism and to reverse this role in the spirit of Biden's national campaign to end systemic racism. It takes courage, empathy, and compassion to reverse our racist rules and laws that we have in place. We all have our blind spots as to where it is that we have been contributing to systemic racism. But I ask that you please put empathy and compassion before harsh judgment and allow all women to make the decisions as to whether they have to choose to have an abortion or not. This is a clear step towards cleaning out rules on the books that have their conscious or unconscious roots in racism, and Rhode Island has the opportunity to lead the way in ending this type of affront. I also oppose Senate Bills 645, 664, and 669. Thank you so much for listening. I do hope that you vote for this bill, 267.
Thank you. Thank you for your testimony this evening. I see no questions at this. Oh, Senator De La Cruz, you may proceed. Just a minute, please. You have a question.
Thank you, Chair Quine. For the most part, I mean, there has been a lot of talk about racism tonight, and so the caller had said that we have all contributed to systematic racism. I would say that the caller should probably perhaps speak for herself, because I haven't contributed to systematic racism. But if there is any that she has contributed to, she's happy to share that with the committee if she'd like.
Thank you.
Okay.
Next.
Thank you. I don't have the power to have any effect on legislation, and I'm not saying that everybody has contributed to it, just that we all look at it and recognize this bill as something that discriminates against people who don't have enough money, people on Medicaid, who are often Black, Brown, and Latinx people, and that has racial consequences. But I do know that there's a whole spectrum of racism in this country and around the world. and it's not always clear cut. We have unconscious ways of doing things that have racial consequences that are unfair, and that's what I'm saying here. No, I'm not saying to you, I'm not sure which senator you are, but that you're a racist. I'm not saying that I need to start confessing of ways that I have unconsciously been racist, but I am saying that this bill is racist. And please don't, please, not this bill. This bill is against the racist implications of the rule that would not cover abortion for people on Medicaid.
Senator
So please don't take it personally, ma'am. It's not meant that way at all, or anybody else in your committee.
I've been called many things, Chair, and I am not offended at all. I think it's good to have a healthy dialogue back and forth, and so I appreciate you calling in and sharing your stance. This is what government is all about, right? I'm so pleased that you called, but you know, I would go back to the comments made about racism. The senators in the chamber that I've worked with for the past several years, I wouldn't call them racist. I think they're good people, and they care about the underprivileged. They care about those that are hurting and in need. And you know, to make such a blanket statement that if a senator disagrees with this legislation, that somehow they're racist, I think it's disingenuous and doesn't really, you know, it doesn't open dialogue. You know, it shuts it down. So that's where I'm coming from. But thank you so much.
Thank you very much for
It's not personal. I would like to say again that it's not personal. It's the not covering abortion for people that don't have the money, and those are largely black and brown and Latinx people. But it's definitely not me coming out publicly like this and saying you're all racist if you don't support our bill. No, it's
Thank you, Catherine. I believe.
Oh, okay. Well, thank you, and I appreciate a little extra time in discussing this. That makes me feel like I'm participating in democracy. Thank you.
Thank you very much, Catherine, for your comments. We appreciate it. Next is Joseph. I believe we have Joseph Bonici on the line right now. Mr. Bonici, you have 3.5 minutes. You are speaking on 267 and a couple of other bills. You may begin.
Yes, thank you very much for the opportunity. I am an immigrant, and it's ironic that I have this opportunity to speak to you, something that I wouldn't have the opportunity in my native country. I'm very grateful about this. I would like you all to imagine, what if we were to remove all duties for goods made in China so they can flood our country, and at the same time destroy our manufacturing base in Rhode Island. We've succeeded over the decades of doing this, but not completely. But let's assume that we would continue with this policy. It wouldn't make sense, would it? And I use this analogy to encourage you to think about what you have in front of you. Our borders are open. Anyone who wants to come in, like me, can come in and steal the bread from under your noses, as I have practically done for 36 years. I don't say this with arrogance. But now you want to destroy your own children, my fellow Americans. Think about it. Thank you.
Thank you for your testimony. Any questions of this witness? Thank you. Next witness, I believe, is David Mitchell. No? Just a minute, please. Okay. Thank you for your patience. Next witness is Tom Draper. You have 3.5 minutes to speak on any of the bills that we've introduced tonight.
And those are the abortion and protect preborn babies?
Yes, you're signed up on 267, 645, 664, and 669.
Yep, very good.
Thank you.
So, yes, thank you. As your constituent, I urge you please to oppose the funded abortion on demand bill, number 267. It's just unbelievable that the Senate is considering such a measure. Also, please support the pro-life bills, and that, will show us that, there's still a good sense of humanity. I'd like to remind you of a very prophetic message from Mother Teresa, who was awarded the Nobel Peace Prize. She said, "What is taking place in America," she said, "is a war against the child. And if we accept that the mother can kill her own child, how can we tell other people not to kill one another?" I believe that what she's saying is that there can be peace. How can there be peace in our state and country when we support this way of life, killing the most vulnerable? I believe this contributes in such a big way to the unrest in our country. And as leaders in our state, please, you can change this. This will change our state and I think have an impact on our country so that every life is considered important. And, I'm a new person to Rhode Island and have learned that there's a large percentage of Christians, and as Christians, we value life and the dignity of every life, born and unborn. Thank you very much, and that's my comments.
Thank you for your comments this evening. I don't see any questions at this time. We will now move on to the next witness. Welcome to the committee. I believe we have Emily Boucher on the line. You have 3.5 minutes of testimony. You may begin.
Thank you so much. I'd like to begin this testimony to briefly but firmly hold each of you responsible to the task of striking down all the anti-abortion bills that are sitting in your committee currently. Vote no on S645, S664, and S669. These bills push nasty rhetoric about abortion and try to limit access and care. We should eliminate barriers to health care, not make it harder to get. A few weeks ago, I spoke on these topics from the perspective that I hold as a high school educator here in the state of Rhode Island. I will now just briefly remind you that when we uphold or worse, create barriers to health care, it is the folks that are most marginalized that are most affected by those barriers. These issues of abortion restriction, they don't affect everyone. They only affect those who can't afford to find a workaround. Those who can't take time out of work or take sick time, those who are too young to be aware of their options or even understand their bodies yet, those who do not have a means of personal transportation or the money to pay for an abortion out of pocket. These laws may govern all of us, but they only affect the people without privilege. They only affect some of us. And those people may not be able to make the calls tonight that you need to hear. Those are trash bills based on scare tactics and fake science. We need to throw them away. I'm done with it. All that being said, I would like to now talk to you about Senate Bill 267 directly. Senate Bill 267, the Equality and Abortion Access Bill, is absolutely necessary to our state. There are currently too many barriers in place for abortion access, and this bill eliminates a big financial barrier that is unfairly waged against state employees and the economically underprivileged. These people are real people. These people are humans with unique lives, unique stories, and they deserve the bodily autonomy to make the choices that shape their unique futures in ways that suit them. Abortion is healthcare, and healthcare should be paid for by healthcare plans. To pay for healthcare is entirely the point of healthcare plans. With the codifying of Roe v. Wade into state law in 2019, Rhode Island underscored with the federal ruling that abortion is healthcare. To hold Bill 267 for further study, or to worse, to just shelf it, to let it die, is a direct contradiction of what the state has already proclaimed. Abortion is health care. Rhode Island needs to give people health care. I understand and I fully respect that people may be vehemently opposed to abortion on a personal or a religious level, but it's a bodily right to choose to have one or not. People who feel that way can simply choose to not have one. This bill is about making sure that people who want one can access one. It's about securing a right to health care. Any other argument is a distraction and a disgrace, and you need to throw it away. To try to ignore this bill is each one of you playing political hot potato, trying to not get caught in the public eye when the music stops at the end of the session and you have to be held holding the potato. This is ridiculous. The only reason this abortion ban has already not been addressed is because people who are affected by this issue are largely already marginalized and therefore less able to participate in the political process that is problematic. An injustice to one of us is an injustice to all of us. It is your job as a committee member to represent the entirety of the state, and you need to do that right now. Do not play games with people's health care. You are elected to do better. You are elected to work towards equality, to a more just future. You pass this bill. Give the people the right that they deserve. It's that simple. I will take questions now.
Yes, Senator De La Cruz.
Thank you, Chair Klein. You sound very passionate, and I understand why. It's it's an issue that really stirs up a lot of emotions, and so I understand that. However, you made a statement that 645 and 664, that they limit access to abortions, but these bills have nothing to do with abortion. So I'd like to know how you misconstrue the bills to somehow state that they have or that they are limiting access to abortion. Could you please clarify?
These bills are about getting in the way of doctors prioritizing the people that are pregnant. Doctors make those calls, not these laws.
Thank you.
We do not need to complicate the lives of doctors. We do not need to complicate their jobs. They are doctors. They go through medical schooling to make those rulings. They go through the process and the emotions of being in the room with those people. They need to be respected, and these bills need to do that.
Senator De La Cruz has another question. Go ahead, Senator.
Chairman Coyne, my question wasn't answered. I'm not sure that I'm not sure if there's a misunderstanding about the bill or a lack of understanding about what the bill does, but it does in no way prohibit abortions. It has nothing to do with a woman's right to choose. So again, the bills are being misconstrued as something else. Thank you.
Thank you, Senator De La Cruz. And I believe that we've hit.
This is what the doctors say.
We've accomplished our point of view from both sides, and I thank you very much. And at this time, I'd like to move on to the next witness. Thank you. I believe we have Linda on the line. Linda, would you state your last name, please? And you have 3.5 minutes to testify.
Fusa.
Oh, say that again?
Uji Fusa.
Thank you very much. You have 3.5 minutes to testify.
Thank you. Good evening, and thank you for hearing my testimony. My name is Linda Uji-Fusa, and I'm co-chair of the Rhode Island Healthcare Access and Affordability Partnership. I usually focus on Medicare for all, single payer, as the way to provide universal comprehensive coverage, including all reproductive health care, as well as alleviate institutional racism, sexism, and economic discrimination. But federal and state leadership's apparent preference for maintaining the multi-payer system and all of its problems through support of the so-called public option makes it important to speak today in support of Senate Bill 267. The state should take action to ensure comprehensive health care coverage for all Rhode Islanders, including those covered under state health insurance plans and Medicaid. Passing this bill is particularly important because state Medicaid covers about 1 in 4 Rhode Islanders, mainly low-income people. About 2/3 of the Rhode Island Medicaid population are women, and roughly 2/3 of adult women on Medicaid are in their reproductive years, 19 to 49. This means Medicaid covers reproductive health care for over 115,000 Rhode Island women, again, primarily low income, And also, about 7% of Rhode Island Medicaid patients are Black. This bill could therefore help over 8,000 Rhode Island Black women seeking such care. The Hyde Amendment already restricts women's access to abortion, and Rhode Island must not add discriminatory restrictions. S267 will help alleviate the sexist, racist, and economic discrimination in our healthcare system caused by our current lack of single-payer Medicare for all. I urge you to pass it immediately from this committee to the Senate floor, or I ask Chairperson Senator Coyne to pass this bill to the Senate Health and Human Services Committee where it belongs, as this is a healthcare issue. Thank you so much. I have to hop to a town council meeting. Take care. Thank you again. Bye-bye.
Thank you. Okay, next person that's up is Mark, or no? Just a moment, please.
Yes, that's fine. Yeah. Senate Judiciary Committee up to transfer now.
3.5 minutes.
About 3.5 minutes, okay? Okay. Okay, no problem. Okay, yep. You can.
Stand by. We're just trying to get the next witness on the phone. We have the next witness on the phone. Welcome to the committee, Dr. Susan Killenberg. You have 3.5 minutes to testify. Welcome to the committee.
Thank you, Chair Coyne and members of the Senate Judiciary Committee for the chance to speak tonight in support of Senate Bill S267. My name is Dr. Susan Killenberg. I work as a psychiatrist in Rhode Island. I'm also a 2021 Women's Policy Institute Fellow with the Women's Fund of Rhode Island. The reason I want to weigh in on this bill is because as a psychiatrist, I'd like to emphasize how important it is that those living with mental illness or substance use disorders have access to affordable abortions. I've spent roughly half of my 25-year career working in the field of women's reproductive psychiatry. I've counseled hundreds of families about management of mental health issues during planned and unplanned pregnancies. And by the way, unplanned pregnancies make up about half of all pregnancies in the United States. I'd like the committee to understand that psychiatric illness during pregnancy is not uncommon. 15 to 20% of women suffer depression or anxiety in pregnancy. 5 to 10% of women have active substance use disorders in pregnancy. And women with bipolar illness or schizophrenia are at extremely high risk for developing psychosis during pregnancy and postpartum. People who live with mental illness and substance use disorders are forced to make complex decisions about their reproductive lives. They must decide if they feel emotionally well enough to carry a pregnancy and parent a child. They're faced with decisions about whether their psychiatric medications could harm the fetus, or if they stop their medications, how would they manage should they become depressed, overwhelmed with anxiety, manic, suicidal, or even psychotic while pregnant. Mental illness during pregnancy is associated with complications such as low birth weight and prematurity, and substance use during pregnancy can have long-term adverse effects on the exposed child. People who live with mental illness or substance use disorders must have financial access to all reproductive health care options, including abortions, should they decide their conditions prevent them from safely carrying a pregnancy. There's simply no justification for restricting financial access to abortion for those on Medicaid or those with state insurance plans. As a doctor, I'm called upon to always act in the best interest of promoting my patients' overall health. I believe you, as legislators, have a similar responsibility. Personal or religious convictions should not dictate legislation that have real and potentially disastrous consequences for your constituents. In this regard, I urge you to vote in favor of Senate Bill 267. Thank you so much for the opportunity to speak with you tonight.
Thank you very much for joining us this evening and for your comments. Are there any questions by committee members? We don't have any at this time. Thank you for joining us.
Thank you. Have a good night.
You too. Welcome to the committee. I believe we have Michael Cottarelli on the phone. You have 3.5 minutes for your testimony, sir.
Thank you, Madam Chairwoman. I will take far less than that. I'm on call to support S645, S644, S669, and thank Senator Dela Cruz, Morgan, Raptakis, and Lobato for their bravery and submitting those bills. And I'd also like to testify against Bill S267. And as a taxpayer and as a citizen of the state, I find it offensive to be forced to pay for the black and brown genocide that's going on in our communities of color. The system that is in place by the abortion providers has a clear tie to systemic racism and white supremacy, and as taxpayers, we should not be forced to fund those evil ideologies that founded those organizations years ago. I believe that people of color deserve better. They deserve better health care. They deserve better health care options. And women deserve better options in general when it comes to deciding to keep their children and other medical decisions they make. And as taxpayers, we should not be underwriting programs that dissuade women or that give them the impression that there are no other options. And I thank you for your consideration tonight, and I thank you all for your duties as our elected legislators. Thank you very much.
Thank you very much for joining us this evening. I see no questions at this time. We'll now move to the next witness. We have the next caller on the line. Welcome to the Committee on Judiciary. I believe we have Julie Lamon on the line, and you have 3.5 minutes to testify on the bills.
Thank you very much for hearing my testimony. I am calling in opposition of Senate Bill 267, the Equality in Abortion Act, and in favor of Senate Bill 645, 669, and I think 644. I've just been listening, and just a little disheartening to hear, especially women, diminishing the value of life to a monetary scale. I believe that every life, no matter the circumstance, is invaluable and should be protected at all costs. And to say that this is systemic racism not to afford abortion, I would counter that to say that systemic racism is to promote the elimination of a population, which is what abortion is actually doing in targeting the poor and minority populations. I unfortunately have chosen abortion in my past and have come to deeply regret it. So I am the woman that these other women are supposedly championing reproductive rights to. But I would like to tell them from the deepness of my heart and my soul that abortion was the worst thing I could have done for myself, my children, and my future family. It has caused myself and my family deep hurt and pain. At the time, I was young and felt that I had no other choice, but I wasn't given good counsel at all. And so I don't want a penny of my tax dollars or anybody else's tax dollars, for that matter, to go toward paying for abortions and hurting women the way that it does and killing children in the womb. I would like to make a comment to the woman who claimed that she was a Planned Parenthood escort and was spit on and harassed by people outside on the sidewalk. And I would like to ask her where that was, because I have been sidewalk counseling for 15 years, and I know others who have been here long before me, and never has it been the case that an escort was attacked. However, I was attacked by a Planned Parenthood escort, and there are police reports to back that up. But there are those of us who stay after the escorts leave and ensure that all the patients are in the doors. We stay in the hopes that a woman will come out and change her mind. And never have we heard of a woman ever being refused an abortion because she couldn't pay for it. In fact, some women have said that they offered to call donors and get donor money, as well as I have many personal witnesses of people whose Medicaid is already paid for abortion. So we've never heard or seen any case where a woman has been denied abortion at an abortion clinic in Rhode Island. So I guess what I would do is I would challenge those who feel like women are being denied abortion because of funding to really kind of state those cases and look at those cases in particular, if there are any. Abortion is also not safe, so I am fully in support of the inspections at the abortion clinics, because we have seen multiple ambulances come to take women away from the clinic and to the hospital. And so nobody really needs an abortion. It's elective, but there are safety measures that need to be taken into account. Thank you very much.
Thank you very much for your testimony. Yes, Senator De La Cruz has a question for you.
I don't have a question, Chair. I just wanted to thank the woman before us testifying. I know that it takes a lot to say, to share your story, and I know she said how difficult it was, and so I just want to thank you for sharing that story, as I know that there are other women that feel the same way that you do. In fact, there was in Roe versus Wade, the plaintiff, she then became a pro-life advocate later on in in her later in life. So again, thank you for sharing that. I appreciate it very much.
Thank you, Senator.
Thank you, Senator. We'll now move to the next witness. Welcome to the committee. I believe we have Stephen Leonardo on the line. Mr. Leonardo, welcome, and you have 3.5 minutes for testimony.
I'll only take 1 minute, and thank you for taking the time to allow me to make my point. Regarding Bill 267, I'm absolutely opposed to it. One of the things I'd like to say is it seems to me the vast majority of the instances where people are voting for extended benefits or extended opportunity for abortion, it seems to me to be a matter of convenience, or rather inconvenience. I think anybody, especially the churches in Rhode Island, which is the most Catholic state in the country, would say, look, if a mom's in danger, her health's in danger, her life is in danger, if it's a case of rape or incest, then certainly we choose the lesser of two evils. But in all the reading and all the statistics I'm seeing, this is a matter of extended birth control. It's a matter of inconvenience. I know in the legislature, even on some of the committee members, there's a big push for animal rights. And I'd like to just make an observation. If I took some of these proposals and I applied them, the same ideals, the same goals to those of animals, I think the situation would be very different. If I took my dog to a vet and said, she's just not the same since she got pregnant, and she just doesn't seem as happy, and it's certainly an inconvenience to me. It's going to be a financial burden. It's going to be a burden on my home. And I requested the veterinarian to perform an abortion on my dog. I wonder what these animal activists would say. I wonder what a vet would say. It seems to me there's a real split between animal rights and human rights. And in some sense, as a voter in Rhode Island, as a person who prides himself on at least being, or trying to be some type of a good Christian voter, we've reduced the rights of human beings to those of animals, or we've raised the rights of animals higher than those of human beings. None of this would stand. If I took these same things and I applied them to an animal situation or a pet situation, none of these would stand. What I'd like to see also is if this is what it seems to be, a last chance, if you will, at birth control, then we should say it. I think it's time people stop voting politically correct and started to vote consciously correct. That's the point I want to make, and thank you for taking the time to hear my point.
Thank you very much, Mr. Leonardo, for your testimony. We appreciate it.
God bless you. Have a good day.
You too, sir. Next, we have Charlotte Lee. Welcome to the committee, Charlotte Lee. You have 3.5 minutes for your testimony, and I have that you're down from the Warren Alpert Medical School of Brown University.
That's right. Thank you so much. Yes, I'm a fourth-year medical student at Brown. I completed my undergraduate degree at Duke in public policy, and I'm here testifying in full support of S-267, the Equality and Abortion Coverage Act. And I want to say first, thank you to the bill sponsors who recognize that the status quo is unacceptable. I think it's really time that Rhode Island ends its two-tiered system that grants full reproductive rights only to those who can afford it. It's really important that we ensure all citizens have equal access to reproductive health care. I think something that's important to remember is that patients with financial resources will always be able to access safe abortion care. If wealthier patients live in areas where there are legal restrictions on abortion care, they can and do travel to obtain medical care elsewhere. If there are high costs for their care, they pay them. If they need time off from work, they take paid days off or bounce back from lost pay. They can afford childcare to cover that time. And this is just not the case for low-income patients. While the Rhode Island Medicaid program provides coverage for most essential healthcare services, it does not cover abortion care. And what this means is that the poorest individuals in our state do not have the same reproductive rights as the wealthy.
Warren Medical School.
In my time at Brown, I rotated in family planning clinics that provided safe, high-quality abortion care in both Rhode Island and in Massachusetts. And the difference was stark. In Massachusetts, when a patient with Medicaid coverage needed an abortion, there was no need for a consultation about prices and payment. The care was covered. We focused entirely on their medical care. In Rhode Island, I had to counsel patients with Medicaid coverage, discussing their treatment options with the caveat that there were some options that were more expensive than others. This was the only rotation in medical school where I needed to tell a patient, we could do this procedure, but only if you can afford it. And I saw patients who had to make a choice between paying their rent and having an abortion. One patient had to delay her procedure as she attempted to find the funds any way she could. Her ex-partner had been physically abusive and financially abusive and had stolen her savings. For these patients who are struggling to pay out of pocket, we use every national and state charity fund available, but even with the support, the cost typically still remains in the hundreds. When you ask medical providers to give one standard of care to wealthier patients and a lower standard of care to patients in poverty, you really are asking us to discriminate against patients who are poor. And in my 4 years at Brown, I've grown to love this state. I could see myself putting down roots here, raising a family, continuing to care for the Rhode Island community. But I can't do that if I can't provide equitable health care to all my patients. And that's why I'm here in support. And just thank you so much for your time and your consideration in supporting this bill.
Thank you very much. Are there any questions? Senator Dela Cruz.
Doctor, thank you for your testimony. These individuals that are on Medicaid coverage, I say I'm not in insurance, so because they're on Medicaid, are they afforded the ability to perhaps get an IUD that would prevent pregnancy, some of them 5, even 10 years, at little or no cost to them? Is that correct?
That's my understanding. Oftentimes, folks who, actually more than half of people who do have abortions are using some form of birth control at the time that they get pregnant with an unwanted pregnancy. So many of the patients we see have been using a form of birth control that is covered by Medicaid, and still, pregnancies still do happen.
Senator Dela Cruz, please, you can proceed.
Yes, I totally agree. It can definitely happen. A pregnancy in the fallopian tube, even with an IUD. But the majority of women, or all of them on Medicaid, are able to get little or no cost contraceptives like the oral contraceptive or the patch or an IUD. Is that correct? And when we're saying that the majority of women who are on them, it doesn't necessarily mean that they're going to get pregnant, but obviously there is a chance that they do. But they are able to get contraceptives, correct?
That's absolutely correct. The statistic I'm citing about the majority is that the majority of patients who are getting abortions have been using a form of birth control in the last month. So, most of the patients that we see for abortion care have been using a form of birth control that has failed in some form. Not to say that most people on birth control need abortions and most birth control fails. That's, kind of just a fine point that I wanted to make. But
Senator Dela Cruz, Senator Dela Cruz, you can follow up. Excuse me one sec. Senator Dela Cruz has a follow-up. Go ahead, Senator Dela Cruz.
Last question, Chair. Thank you so much. I'm curious to know if you have any kinds of statistics available. Truly, I am generally interested in knowing how many of those were on the pill, because I know that sometimes a woman can forget to take her birth control pill, and so that could result in pregnancy. And how many of those pregnancies were on IUD? Is there such information available or no?
It's a great question. I don't have it on the right at access accessible right now, but I would expect that most would be one of the less effective forms of birth control. I think that is in line with my experience and makes logical sense. But I don't have that statistic available right in front of me.
Thank you very much. Are there any other questions from any other members of the committee? Hearing none, thank you very much for your testimony. You have a nice evening.
Thank you.
Thank you. Our next caller is Denise LaPrade. Good evening, Ms. LaPrade.
Good evening. It's Mrs. LaPrade.
Welcome, LaPrade. Forgive me. Welcome to the committee. You have 3.5 minutes, and you may proceed.
Thank you very much for your time. I have been given some of the bills that are being reviewed this evening, and I would like to voice my opinion one way or another on 4 of them. I would like to actively support Bill SO645, which requires abortion clinics to have their license revoked if there are any uncovered deficiencies like any and all other health facilities. I'd also like to vocalize support for Bill SO664, Born Alive Infant Protection Act. I do believe every child deserves the best of health care. I myself have been a labor and delivery nurse for 15 years and have gone well above what needs to be done to make sure a newborn gets the best of care, even some as little as 4 pounds. I'd also like to offer support for Bill SO669 for the Rhode Island Pain-Capable Unborn Child Protection Act. As our research and science is finding out that our children do feel pain, they do show grimaces during amniocentesis, and all pain should be cared for like we care for any patient in the hospital. It is now one of our other major reportable symptoms on all patients is pain, and what do we do for it? Our newborn babies, unborn babies, especially newborns, need to be able to have protection against the pain and try to resolve as much as possible. They can't vocalize, but they can grimace and show a sign. I would like to vocalize objection to Bill S0267 that allows for my funds, my tax-paying dollars, to fund abortion on demand. I understand that everyone at every socioeconomic level is entitled to good health care, but I do not believe abortion should be on demand at every and any stage of gestation. I very much oppose this bill and wish that you will look at that further at the wording that you have chosen. I also would like to object to Bill SO775, which allows for terminal patients to have doctor-assisted suicide by prescription medication for ending their life. I believe that when it comes, and that we should sympathize with these people and what they are going through. I also object to the point where the death certificate would not list this exact cause of death, but the illness that the patient is suffering from. I believe we should care for these people holistically. We should manage their pain. We should sympathize and empathize that they do not have the right to take their life. And that is a religious belief that I do have. That is my opinion on those 5 bills, and I thank you very much for your time.
Thank you very much. Are there any questions from any members of the committee? Hearing none, thank you very much. You have a nice evening. You're welcome. The next bill we're going to move on to is Senate Bill 645 by Senator Dela Cruz. Our first caller is Stephen Cavallari. Good evening, Mr. Cavallari.
Good evening. I'm from Bristol, Rhode Island,
yes.
And these are 3 bills on euthanasia.
Yes, you're also signed up for 664, so feel free to testify on, I'm looking to see, both those bills. You could testify on both those bills. Go ahead, you may proceed. You have 3.5 minutes.
Yes, I just wanted to voice my opposition to the ones on euthanasia and abortion.
Go ahead. Thank you. You may proceed.
Yeah, I believe my representative is Ms. Speakman. And I have written to her and told her that I am opposed to the bills. I just wanted to make sure that my voice was heard, and I know that there's a lot of pros and cons to it. I've heard them all, and I just want to make sure that my voice in opposition of them is heard.
Thank you very much. Appreciate your testimony. Are there any questions from any members of the committee? Hearing none, thank you very much. You have a nice evening.
Thank you, you too.
Welcome. Our next caller is Gail Sherman Cunningham. Good evening, Ms. Sherman Cunningham.
Yes.
Yes, welcome to the committee. You have 3.5 minutes. You may proceed.
Yes, I just want to say that I'm opposed to the taxpayer funded abortion bill number 267. I guess it's SO 267. And I didn't think that we should use tax dollars to pay for abortions. As long as they always profess it's their choice and their body, then it's your choice to pay for it, you know. I don't think they should inflict their decisions on the public, you know. I think they should stand up and pay for it themselves. And, you know, I'm opposed to abortion anyway, and I'm for the bill for the S645, the yearly inspection of abortion facilities. Because even though they say it's safer, they have said that it really isn't safer. And they get lax about things if they don't have inspections, and I'm for the S644, the Born Alive Infant Protection Act, because they can feel pain. And if they're living, they're born and they're living, they deserve to live. For people who survived abortions, you know, you can't believe their mothers did this to them. And then I'm for the bill on SO 669, the Pain-Capable Unborn Child Protection Act. No abortion after the baby feels pain at 20 weeks. Because how would you like to have this done to yourself? I don't think anybody would want that done to themselves, and have their arms and legs pulled off and mutilated within the womb and then delivered with everything severed. I don't think any of us would want that done to ourselves, and I don't think a child that can't speak for themselves, I'm speaking for them, that this should not be done at all, because it's basically murder, and I think doctors should be considered murderers who perform abortions, and they've turned mothers into murderers of their children. They don't know what they're doing. It's like the Scarlet Letter, you know, they just want to hide their pregnancy and get away from taking care of it, the years of taking care of the child. So, and there is help available for them if they do want to have the child, and they can always put it up for adoption. So I think that I am for the 645, the 644, and the 669 bills, and I'm opposed to the bill for taxpayer-funded abortions because they keep professing it's choice and their right and it's their body. Well, if it is, then you should be paying for that yourself, not making us, you know, collude in the abortion with you and have us pay for it. That's a SO 267.
Thank you very much. Oh, go ahead. You may finish. Go ahead.
I'm speaking for the unborn that can't speak for themselves. It's just murder. I mean, we're adults and we can't decide what murder is, pulling people's arms and legs off, you know. The baby's arms and legs off. They have a heartbeat. They're living. And they can feel pain.
Thank you very much. Thank you for your testimony. Are there any questions from any members of the committee? Hearing none, thank you very much.
Well, I think that if you wouldn't want this done to yourself, which I don't think any of you would want this to have happened to yourself when you were in your mother's womb, you have to agree with me that it is a living being that can feel pain, you know?
Thank you very much. Appreciate your testimony. You have a very nice night. Thank you.
Okay, thank you for listening to me.
Certainly. Our next caller is Kara Young. Kara.
Hi. Hi, Chair. How are you? And all the members of the Senate Judiciary Committee. Can you hear me okay? I'm on speakerphone. I apologize.
We can hear you fine, Kara. Good to hear you. You have 3.5 minutes. You go ahead. Take your time.
Okay, great. So my name is Kara Young. Before I thank our wonderful pro-life state senators who are sponsoring these bills, the pro-life bills, for their courageous defense and their respect for the dignity of I just want to, by name, thank Senators Jessica De La Cruz, and you are on fire, girl, tonight. Thank you for all of your great testimony and your knowledge on all of these bills and the comments. Senator Elaine Morgan, Lou Raptakis, and Frank Lombardo for sponsoring these bills, and then also all of our pro-life state representatives as well for the companion House bills that were heard previously. So I myself want to voice my strong opposition to Senate Bill 267 to expand taxpayer funding of abortion. And I'd also, the president and CEO of AUL, Americans United for Life, who I believe submitted written testimony earlier today, has asked me to also vocally register AUL's opposition to Bill 267 to expand abortion coverage, and also their support for the three great pro-life bills that are being heard today. So Catherine Glenn Foster, who is the president of AUL, she was also formerly the executive director of Euthanasia Preventive Coalition USA, and she is also opposed to Bill 775, the Assisted Suicide Act, as I am as well. So I wanted to sort of focus quickly on Bill 645. It is nothing short of common sense to hold abortion clinics to the same licensing requirements as other similar healthcare facilities. And with all the rhetoric about quote-unquote abortion care and just the staggeringly ironic assertions that the killing of an unborn baby is health care, I just don't understand why. What possible reason could abortion proponents have for not holding abortion clinics to the same health care standards as other facilities? And in the interest of providing women with the highest standard of care, the safest environment possible, this bill really should pass. And I don't think people realize that it is not a safe procedure. Like, I hate even calling it a procedure when it results in the death of a person, but the unborn baby. But the risks during abortion are great. They really are. Complications can be very traumatic. And even if you just look, I did like a quick search of just over the past year. I just typed in Planned Parenthood. You can see in Orange County, California, there was a botched abortion there, and I guess at that facility there, it's reported that there have been 10 botched abortions at that one alone. In Chicago, Illinois, last May, there were 2 botched abortions where they called it a uterine perf, which is slang for a uterine perforation. And I guess that it's so common that they, call it that, where they had to be brought to the hospital and the woman was left with a hole torn in her uterus. And just 2 days ago in Charleston, South Carolina, at the Planned Parenthood there, a woman would not stop bleeding. It was a possible uterine perforation again and had to be brought to the hospital. These incidents are not new, and they really underscore the possible environment at these abortion clinics where, their children are being killed. It's not going in to have, just your blood pressure taken. It's not going in for, this is stuff like the previous caller said. And I'd also like to touch quickly on Bill 664, the Infant Born Alive Act. In my testimony in previous years, and I'm sure a lot of other people have brought this up as well, there's a woman named Abby Johnson. She's a real pro-life hero. She used to be Bryant, Texas, and she actually got the Planned Parenthood Employee of the Year award one time. And when she found out how profits, they said, Abby, you got to get your abortion numbers up. She said, well, I came here thinking I was helping women. She had no idea. She left, and then she really has spent her life exposing Planned Parenthood since then. Of course, they tried to stop her with all sorts of lawsuits, but she has gone forward, and she is the movie Unplanned is about her and her story. But when she talks about this issue specifically, infants born alive, and she's seen a lot firsthand, of course, she said, this is all quotes from her, what happens to these babies who are born alive and left to die without medical intervention is horrific. Once the baby is born,
Sorry, I had my microphone off. I apologize for that. We lost Kara. Did let her go over because a couple of our other witnesses, and we're getting near the end of the list, had stopped, didn't pick up. Are there any comments or questions to follow up on Kara's testimony from any members of the committee? No, hearing none. Kara, thank you very much for calling in. Appreciate your testimony. Our next witness.
Carmichael.
Good evening. It's Paula Carmichael with Rhode Island Now. Good evening, Ms. Carmichael.
Yes, hello.
Yes, welcome to the committee. You have 3.5 minutes. You may proceed.
Very good. Thank you, members of the Judiciary Committee, for giving us this opportunity. On behalf of Rhode Island Now, we're submitting this in support of S-267, the Equality in Abortion Coverage Act. As you know, we supported and it was passed, the Reproductive Privacy Act, 2 years ago. However, although Rhode Islanders' right to an abortion is guaranteed at present, the access is inequitable. The current situation is that people who are state employees or on Medicaid may not have coverage or do not have coverage to abortion services, and we are asking that this inequity be corrected. They are currently excluded from that. We note that because of these existing exclusions, disproportionately low-income Rhode Islanders, immigrants, people of color, and young people are disproportionately impacted by these current exclusions, and we urge you to support this bill to expand the reproductive freedom of Rhode Islanders. We also ask you to reject S-645, 664, and 669. Thank you so much.
Thank you very much for your testimony. Are there any questions from any members? Senator Dela Cruz.
Thank you for calling in and testifying. I was just wondering, what is your objection to 645 and 664, as they have nothing to do with abortions?
Go ahead. You may answer, Ms. Carmichael. Ms.
Can
Carmichael.
you repeat the question?
Senator Dela Cruz, please.
Absolutely. I was wondering what your objection to 645 and 664 were, because they have nothing to do with abortions.
Well, 645 in particular, it seeks to uniquely inflict extra scrutiny upon facilities that provide abortion services. So I'm not sure how you can say that it's not related to abortion.
Senator Dela Cruz, you can follow up.
Thank you, Chairman. The bill clearly states that the licensed healthcare facilities that are used to perform abortions shall meet the same licensing requirements, not extra scrutiny.
Well, if you read the bill, it says it requires the licensed healthcare facilities, when their inspection uncovers deficiencies, to have their license revoked. I don't think that there's any other facilities that are being put to that level of punishment. In general, when facilities are inspected, there is a healthy back and forth. I mean, the way that that's written, if you find a single M&M on the floor, that would be cause for a complete forfeiture of license.
Senator Dela Cruz.
If any facilities that are not meeting the standard level of care, I would think that anybody would agree that the facility should be shut down until they can rectify any of the deficiencies, and that goes for any healthcare facility.
I would
respond.
presume
Go
then that you think if any nursing home has a facility that they should be shut down and all of their residents be shipped out to, I don't know where. You know, again, I just don't think this is not a healthy way to accomplish these kinds of things. If what you're really looking for is
Senator Dela Cruz has a follow-up.
Yeah.
Senator Dela Cruz, go ahead.
The bill does not say that the facility will be shut down and will never reopen. It says that and I'll read it to you, so that any inspection reveal a licensing requirement deficiency shall result in the facility having its license revoked. So when the facility is in compliance, they would be able to operate. I think that's fair. Any facility, healthcare facility, if you're not following standard protocols of medicine, if you are diverting or if you are in non-compliance, You are a danger to society and you are a danger to women. And all I keep hearing from Women X Project, Planned Parenthood, and all proponents that support abortion rights is that we want safe and legal abortions. Well, you have legal abortions now. Well, this bill ensures that healthcare is safe for all women. Thank you.
Thank you, Senator. Are there any questions from any other members of the committee? No, hearing none. Thank you very much, ma'am, for your testimony. You have a nice evening.
Thank you.
Thank you. Our next caller is Jacqueline Goldman. We're now moving on to Senate Bill 664. Good evening, Ms. Goldman.
Yes.
Yes,
Hello.
welcome to the committee. You have 3.5 minutes and you may proceed.
Great, and I'll try to take up less time than that because I know that it's probably a long hearing. So thank you so much. My name is Jacqueline Goldman, and I'm here to support Senate 267 and then oppose 645, 664, and 669. So abortions are essential health care. For many people with gestational capabilities, being able to get one, like for people, this can be essential to health and well-being in a lot of different ways. And this is why we need to make sure that it can be accessed by anyone. 267 is really important because it makes sure that you can't, that like people with Medicaid can get access to abortion, and people with other sort of state-paid plans. I'm sure you've heard a lot of really compelling testimony and personal anecdotes of why people have really needed this. And I think that people should not be able, like people should have access to abortion regardless of what kind of insurance that they have, especially because a lot of Medicaid recipients are people who are either medically or financially vulnerable. They need to be people who also have access to this life-saving, and not just physical life-saving, but also mental and other such things. And then things like, pain-capable unborn child protection, right? Like, that then sets the time limit to be able to get an abortion to like very, very soon after someone might even know that they're pregnant. And then this would just make it so that a lot of people with gestational capabilities cannot access abortions. I just think that being able to make sure that everyone has access to like really essential health care is vitally important, and that should not really be something that is gate kept by different kinds of insurance plans and things like that. So that's really all I have to say.
Thank you very much for your testimony. Any questions from any members of the committee? Hearing none, thank you very much. You have a nice evening. Our next caller is Robert S. Smith, MD. Good evening, Dr. Smith.
Yes, I'm here.
Yes, welcome to the committee. You have 3.5 minutes. You may proceed.
Thank you. So my name is Robert S. Smith, MD. I'm a retired OBGYN doctor. I live in East Providence in Senator Lawson's district. And I appreciate the opportunity you have afforded me to talk to you for just a few minutes. During my training and my 34-year career, I delivered approximately 7,000 babies. It was so wonderful to be part of the joyous experience of helping a woman have a baby. But I also know the despair, anxiety, and depression of a woman who's pregnant and doesn't want to have the baby, and whose insurance denies coverage for an abortion. Currently in Rhode Island, women on Medicaid, or a woman who works for the state of Rhode Island, has insurance which denies coverage for an abortion. That's discriminatory. That's unfair. And I ask you to please support and pass Senate Bill 267 to change this. Now, I oppose Senate Bill 664, the Born Alive Infant Protection Act. Let me state and explain that such a happening is extremely rare. In my 34 years of practice, I never had such a thing happen, and I never knew another GYN doctor who did. If this extremely rare event were to occur, the patient and her gynecologist should be on the same page when discussing what will happen during and after the procedure. Legislators and politicians should not be involved. And I ask you, as legislators, to stay out of the operating room. Please, let the medical professionals do their jobs. The doctor has spent 4 years in
Doctor,
medical
hold on one
practice.
second. We have a question from Senator Dela Cruz. Senator Dela Cruz, you may proceed.
Thank you, Chairman. You stated that it is extremely rare, but extremely rare does not mean that it never happens. So there are instances in which it does happen by your own admission. I sat through 13 hours of testimony my first term as a senator, and I heard that abortion is not used as birth control, and it's extremely rare, and we are only expanding it to make certain that women have access to abortions. So let's use that same logic and bring it over to this bill, where, although extremely rare, we should still provide protections for infants that are born alive, because they deserve the same kind of care anybody else would in their state of despair.
Doctor, go ahead. You may respond.
Thank you. Let me continue. The doctor has spent 4 years in medical school, 4 years in residency, and more years in practice. He or she knows that if, for example, a baby is born with congenital abnormalities incompatible with life, then efforts to try to keep such a baby alive are fruitless. This bill, in my opinion, is an effort to intimidate doctors with the threat of criminal liability for performing safe and legal abortion, which will have a chilling effect on the ability of women to access the services they need in Rhode Island. And I urge you to oppose this bill. Thank you.
Thank you, Doctor. Senator Dela Cruz. Senator Dela Cruz, you may...
I'm unmuted now.
It's okay.
Thank you, Chair. I appreciate that these physicians have been to school for many years and the work that they do in providing good health care to women. However, it is not the doctor's decision whether or not a baby lives or dies. When a baby is born alive, that baby deserves the right to health care. And I believe doctors take a Hippocratic oath, right, to do no harm, and to decide unilaterally if a child should live or die definitely goes against that oath. And so I will say again, it is not up to a physician, regardless of how many years of education that they've had, to make the decision whether a person lives or dies.
Thank you. Doctor, would you like to respond?
I would say that there are situations in which any sort of resuscitation will be fruitless, because if a baby has abnormalities that are incompatible with life, it is going to be a fruitless effort. Remember that this bill is talking about the possibility of a baby surviving after a failed abortion or after an abortion, but these are so rare because today abnormalities are discovered so early in pregnancy that a D&C would not result in anything, in any kind of an embryo being born alive after an abortion. These cases are so infrequent. Like I said, ladies and gentlemen, I had a very active practice with 3 partners for 34 years. We never saw anything like this.
Thank you, Doctor. Senator Dela Cruz.
Thank you, Chair. I feel I must double down on this. Infrequent or not, again, it is not up to the physician to decide whether or not who lives and who dies. And any physician that would make such a decision should obviously this should be regulated, but any physician that makes such a decision should be criminally liable for deciding whether or not a baby lives or dies. It is not their decision. Absolutely not.
Thank you, Senator. Doctor, if you'd like to respond, I'll let you, and then we're going to move on.
My final comment would be that before an abortion, the patient and the doctor understand the reason for the abortion and what would happen afterwards. And I think it's the patient's choice whether to terminate a pregnancy or not, and it should not be a legislator's choice to be involved.
Thank you, Doctor. Thank you very much.
Thank you.
Have a nice evening.
Thank you.
Thank you. Our next caller is Timothy Gambles. Good evening, Mr. Gambles.
Hello, good evening.
Yes, welcome to the committee. You have 3.5 minutes, and you may proceed.
I do appreciate and honor the board, the committee, and this opportunity to be here to speak on behalf of the Unborn, the Alive Infant Protection Act. First off, I want to start off by saying how sad that it is that we have come to this point as a society to where we have to even gather to make such decisions to see if it's even a valid point to protect an unborn, a child, first off, innocent, who we tried to kill, happened to make it out alive. And now we have to make a decision to protect this child in this life. Regardless of what the mother wanted, that child did not ask to be here. None of us alive right now had ever asked to be here at all, but yet here we are. And I do believe that it's been the greatest tragedy of this past generations to slaughter countless of millions of children. We are missing an entire generation, and I'm not certain if people even stop to wonder what we have lost and what we have done to our society through the horrific acts of abortion, regardless of the cause of which the inception had happened. We have killed countless of teachers, songwriters, book authors, cures of unknown diseases, great politicians, great leaders. Who knows what we have done in the slaughter of these children in our generations past. But I definitely stand for allowing a child to live. And I pray to God that each of you would find it in rule to support this work, to protect any infant that is born alive still. They have a better, more opportune chance to have a fighting chance to survive if anybody else. If the doctor and the mother and everybody that this child was hoping and was depending upon to be alive tried to kill its life, we owe it to that child to defend that child against the work of the mother and against the work of the hospital or the doctor trying to take its life. At that point, I do believe we owe that child a fighting chance to live. I just want to thank you guys for your time.
Thank you very much, Mr. Gambles. We appreciate your testimony.
Thank you.
Seeing no questions at this time, we'll go on to our next witness, which I believe is Corey Garland. Good evening. Welcome to the Committee on Judiciary. I believe we have Corey Garland on the line. You have 3.5 minutes, ma'am.
Thank you. Good evening, Chairperson Cohn and members of the Senate Judiciary Committee. My name is Corey Garland. I live in Newport, Rhode Island, Senate District 13. I want to thank Senator Oyer for her service as well as for her attention to these issues. I'm here tonight in support of Senate Bill 267, the Equality in Abortion Coverage Act, and I'm also going to deliver a very brief opposition to Senate Bill 645. Rhode Islanders deserve accessible and comprehensive reproductive health care, and this bill will make that a reality. As a former board member of Rhode Island's Abortion Fund, I have heard countless pleas for assistance from Rhode Islanders who are scrambling to figure out how to pay for an abortion. Cost, unfortunately, is one of the primary obstacles to abortion access. On average, a first trimester abortion costs around $500. Between 14 and 20 weeks gestation, the average cost is around $750. After 20 weeks gestation, the cost is upwards of $1,750. If an individual does not have insurance coverage for this procedure, they often must cobble together funds from many resources and make hard choices, sometimes between paying rent or getting the health care they need and want. Often individuals would delay the procedure in order to gather funds, and this delay would only increase the cost of their procedure. A person's wealth should not dictate when someone should start a family, but under our current laws, it does. Rhode Island's Abortion Fund could only help a finite number of individuals. When we told someone that we could cover even some of the costs, the relief in their voices was palpable, but it never gave me a warm and fuzzy feeling. Honestly, it angered me that these folks had to basically panhandle to get the health care that they wanted and needed. No one should have to endure that stress or indignity for basic health care. This is a matter of health equity. I know you've heard a bunch of people say that tonight, but I just want to underscore that. No one should be denied access to abortion because of how much money they have or the kind of insurance program they use to get their health services. I urge you to support this bill. Regarding Senate Bill 645, I believe this bill has one purpose, and it's to create special, medically unnecessary and onerous requirements solely for abortion providers in order to make it harder for them to provide care. This bill is unnecessary for two reasons. One, abortion is an exceedingly safe procedure. In fact, it's one of the safest medical procedures provided in the United States. Two, Rhode Island's abortion providers are already subject to existing licensing requirements and Department of Health inspections that apply to freestanding ambulatory surgical centers and hospitals. While it is the state's job to institute both reasonable protections to ensure healthcare providers practice medicine appropriately and evidence-based healthcare regulations that align with accepted professional standards to ensure the safety and well-being of all patients, this bill is not needed, reasonable, or evidence-based. Rather, it just creates one more hurdle for abortion providers and, by extension, individuals seeking abortion care. Rhode Island already appropriately regulates abortion providers. And I think Senator Oyer earlier touched on this quite eloquently. I urge you to oppose this bill. Thank you very much.
Thank you very much for your testimony. Yes, I do have a question from Senator De La Cruz for you.
Okay.
Senator?
Thank you, Chair Klein. So I heard you speak that this bill implements a special requirement and also that it makes it harder to get care. I will continue to state what exactly the bill says. And on the very first page, starting on line 4 into line 5, says the licensed healthcare facilities that are used to perform abortions shall meet the same licensing requirements as other similar healthcare facilities. This bill in no way tries to prevent abortion and only tries to ensure that women are receiving the best care possible in the safest environment possible. And so evidence-based, let's talk about that for a minute since you brought it up, is that in 2019, when I was on the Senate floor debating whether or not this very same issue, was that for 10 years, for a look-back period, I asked the Department of Health, I said, can I please have the last 10 years of inspection reports? And the lady on the other side said, oh, that's so easy, there aren't any. So there are standards, but they are not being met. And this is very clear, and it says that they shall be inspected and shall meet the same licensing requirements. To say otherwise is misrepresenting the bill.
Thank you, Senator.
May I respond?
There's a lot of background noise. Did you want to respond?
I did, yes. So I agree with Senator De La Cruz that the first provision of her bill does state that the licensed healthcare facilities that are used to perform abortions shall meet the same licensing requirements as other similar healthcare facilities. And they do, as freestanding ambulatory surgical centers and hospitals. They already meet those requirements. So then there is the added B, C, and D of that law is adding additional provisions just to abortion providers, which is, again, something that Senator Oyer had touched on earlier. And then there will be a panoply of regulations that come from that. Regarding her second point about in 2019, her research, I completely believe what Senator De La Cruz is saying. I have no idea if between 2019 and today there have been any inspections of those facilities, but I would say that our Department of Health is inspecting freestanding ambulatory surgical centers and hospitals. I have a hard time believing that they're not doing that. Also, if you go online through the Department of Health's website, any person can create a report saying that they have an issue or they believe that a facility is not in compliance. And
Senator,
it's quite easy to do that. So I do think that there are measures in the system already to protect
Senator
people
De La
and
Cruz
protect
has
women.
another question. Senator?
Sure.
Chair, I don't have a question, but I will say this. Again, misrepresenting the bill. In no way does the bill single out Planned Parenthood. It says, and it's a few lines, so I'm going to read it to everyone so that they understand clearly what the bill says. The licensed healthcare facility that are used to perform abortions shall meet the same licensing requirements as similar healthcare facilities. B, all licensed healthcare facilities that are used to perform abortions shall be inspected yearly to ensure that they are compliant with all applicable laws and regulations. C, the Department of Health may conduct unannounced inspections of those licensed healthcare facilities that perform abortions. And D, the inspection that reveals licensing requirements deficiency shall result in the facility having its license revoked. Note that it's talking about facilities, not singling out one facility like Planned Parenthood or any others in the state. It is an umbrella of all facilities shall fall under this requirement if they provide abortions. So to say otherwise is inaccurate and gives a false narrative of what the bill does. Secondly, since 2000, there have been 0 inspections of Planned Parenthood. It is online, and my shock prompted me to call the Department of Health, and my shock was then amplified because they reaffirmed the information that I had seen online, that there were no inspections. That is not safe for women. We talk about safe and legal. Again, we have it, it's legal, but it's not safe if we're not having yearly inspections. And we want to protect women.
Thank you, Senator De La Cruz, and we must move on to our next witness, which I believe is Celia Devine. Good evening.
Well, anything about who I am?
Good evening. Welcome to the committee. I believe we have Celia Devine on the line, and you have 3.5 minutes for your testimony.
Okay, I guess I'm going to do the born alive infant first. I'm a retired professor, and I've published widely in the area of life issues. I want to just start with a story, okay? There's a young OBGYN doctor was going through the wards, and one of the cleaning staff came up to him and said, "There's a baby crying in the soiled utility closet." So he went in there, and there was this little boy lying there, screaming his head off. So he picked the baby up and took it over to the preemie unit to get cared for. And another doctor came in a bit later and said, "You saved an abortion. You saved an abortion." It wasn't a baby anymore. It was an abortion. It had been sort of marked to die, and there it was supposed to die. So it was facing death by starvation, dehydration, which is very, very painful. And it turned out that the little boy got very good care, came through with no lasting injuries. The doctor kind of kept up on it, and hopefully at some point we'll be able to be adopted out to a loving family. Since there's, such a shortage of babies for adoption these days, somebody will be very delighted to take the baby in and care for him. So the fact that they gave the kind of care appropriate to the gestational age pulled him through. So especially abortion survivors. It's just any baby that's born alive should get the treatment it needs. Okay, have I done my time already?
You can finish up, yes?
I mean, on that question, or do I do the other question?
No, you have 1 minute remaining, ma'am. Do you want to say that you support or oppose the bill?
Which one?
The
born alive and infants, I support.
Okay.
And the one about public funding out of tax money, I do not support. Is that the one I can talk about now?
Yes, you have 50 seconds remaining.
Okay. Okay. I like to think about the way this question is framed. Like, women have a right to an abortion. Legally now, I don't think, in fact, morally they do. But so does that mean that the public should facilitate this and support it? No. I mean, there are lots of rights that people have that taxpayers don't have to step in and handle. I have a right to own a gun. Does that mean we should buy guns for everybody? The fact that you have a right doesn't entitle you, if you in fact do have one, to have taxpayers fund it, especially since in this case it's so fraught with people being deeply opposed. And it's as though there's a good being passed out, and they want to get a fair distribution of an equal amount of abortions. And I just want to say one thing very straight up. I mean, abortion is not a good thing. It's not something that you should regard as something to be, get a fair share of. I want to read just one very short quote.
I'm sorry, ma'am, your time is up.
I have to read this.
No, I'm sorry, you cannot.
2 sentences.
We must move to the next witness, but thank you very much for calling in this evening. Thank you.
Okay.
Our next witness is Cheryl Connor. Good evening. Welcome to the Committee on Judiciary. I believe we have Cheryl Connor on the line. You have 3.5 minutes for your testimony, ma'am.
Yes, ma'am. Thank you for giving me the opportunity to testify. I appreciate the call and the effort. I'm speaking on behalf of myself and 3 other family members. One is my husband, who's sick and can't speak, and 2 of our adult children are working. I would like to actually speak about several bills. The first being S-645, the yearly inspections of healthcare facilities, abortion facilities. I'd like us to try and leave ideologies aside and just try and unite around some basic truths here. Just some stats. 1 in 25 people are accidentally acquire infections in hospitals. Hospitals, as we know, are regulated very, very strictly. They have strict regulations and guidelines regarding control of infections, and yet even with those guidelines, 1 in 25 people in the United States acquire unnecessary and accidental infection. Our abortion facilities are not inspected. Well, we'd like to all hope that the best of care is given. I think sometimes laxity, and we all know laxity is a part of human nature, and inspections, I think would greatly reduce the chance of that laxity and protect our women. The second bill that I'd like to speak on is S-664, the Infant Born Alive Act. This is, I think, just, I don't even know why this would have to be discussed when you're dealing with an infant who is alive, that why basic care wouldn't be provided to make sure that child was provided a chance to live the same as any other child that's born alive. The next act, the next bill, S-267, the expansion of abortion coverage. I believe that, a right to choose, the privacy between a woman and her doctor. Well, okay. If you do not want people involved in a personal decision, do not involve them in a personal decision. Make your own decisions, but don't expect other people to be involved and pay for them. I think that's a violation of conscience. It's a violation of religious liberty. And I'm strongly against S-267. Also, S-669, the Pain-Capable Unborn Child Protection Act. Once again, I'm not even sure why this would even be a discussion. I mean, if a baby or when a baby begins to feel pain, why we would not, as a society, have enough compassion for that infant to not harm that child in any way, including just destroying it and ripping it limb for limb in the womb. I think that's beyond words. So once again, I appreciate very much the time that you've allowed me to share my thoughts on this, to listen. And once again, I'm speaking on behalf of 3 other adult voters in my family. So
thank you.
Thank you for your time.
I do have a question from Senator De La Cruz for you, though.
Yes, ma'am.
Go ahead, Senator.
Thank you, Chair Coyne. Thank you for calling in, ma'am. So, I hear the concern in your voice when you're talking about Bill 664, the Infant Born Alive Act, and how you wonder even why there would be such a bill necessary. It would seem, obvious that we would do that, but yet there was a physician, retired physician, that just called in a few callers before you, that he asserted that he had the right to make that decision. And so it's unfortunate that we actually need this law, because there are physicians that feel that they have the authority to decide whether or not a baby lives or dies. So thank you for calling in and expressing your support for those bills.
Thank you very much.
Thank you very much for giving me the chance to express them.
Thank you for joining us this evening. We're now going to move to our last bill of the evening, S669. I believe we have David O'Coin. Good evening. Welcome to the Committee on Judiciary. I believe we have David O'Coin, Family Policy Alliance of Rhode Island. Welcome to the committee. You have 3.5 minutes.
Okay. Thank you very much. I'd like to speak in favor of the 3 pro-life bills and against the pro-abortion bill. As far as the pro-life bills, just 3 points. Abortion does kill a real person, and that's evidenced by when there have been born alive babies as a result of failed abortions. Those babies grow up to be real-life people. I think it was Cecil Richards, former president of Planned Parenthood, said that life only began for her 3 children when she gave birth to them. But that's not true, because these botched abortions, these babies grow up to be real-life people. So it really does evidence that life begins at conception. And then the second point I want to make is that aborted babies do feel pain. If you've ever seen the Unplanned movie, that ultrasound shows a baby moving away from that vacuum cannula as it's pulling apart its limbs. It's trying to get away. And there's so many other stories of babies that were born preemies, and yet they can grow up, grow, and live relatively normal lives. But during those times, they experience pain. There's sensitivity towards so many different things. And then the last point, I think, and probably the best one, is that there are better options available to women. I'm also a pastor, and I've been in the pastorate now for a good 30-plus years. And I think the stats are pretty true that so many women have experienced abortion, and every single one of them that I've spoken to suffered from it, whether it was 10, 15, 20, or 30 years later. Spoken to a woman in her late 70s who just regretted having an abortion. So there's better options. I think there are a lot of options with crisis pregnancy centers. We have a couple of them in Rhode Island. There are some in Massachusetts, and there are some in Connecticut as well. And they come alongside the woman to empower her. And what they do is really just tell her, you can do this. We're going to help you do this. And as you get through it, we'll be right there by you. So there are better options, and I've just seen the repercussions from people who don't choose life. So that's all I have to say. Thank you.
Thank you very much for your testimony. I don't see any questions for this witness at this time. We'll move to our next and last witness of the evening, Mr. Michael Benson. Good evening, Mr. Benson. Welcome.
Good evening.
Welcome to the Committee on Judiciary. You have 3.5 minutes for testimony, and you may begin.
Okay, thank you. Thank you for taking the time to allow me to speak. I was actually testifying to 3 of the bills that were under consideration this evening. One is the pain-capable bill. Just following the science, there's the life of infants in the womb that they are able to feel pain during the developmental process, and it's important that we begin to understand that and follow the science. So I would implore the judiciary to consider when those times are and to make their judgments accordingly. And then as far as the healthcare facility inspections, it's important that if abortion is considered healthcare, that they follow the same guidelines as all other healthcare facilities. It only makes sense. So short and sweet, to the point. Thank you very much for taking my call, and I wish you Godspeed.
Thank you very much, sir, for your testimony. Any questions of this witness? Seeing none at this time, that concludes the public testimony portion of the agenda this evening. I would like to entertain a motion to adjourn.
Motion to adjourn.
Thank you, Senator Rogers, for making that motion, seconded by Senator Reptakis, Senator Oyer. All in favor?
Aye.
And we are adjourned. Thank you very much.